Assalamu alaikum. These are the missed videos in the external appearance. I'm sorry because they were not attached to the file, so I'm sending them in a separate file. You can watch the videos, you can see it inside the presentation.
To conduct a corneal light reflex, you'll need a pen light and a patient. You'll ask your patient to stare off in the distance or focus on something at least 15 feet away. With this test, the corneal light reflex test, you're testing for ocular alignment by reflecting your pen light off the patient's pupils. You're looking for esotropia, exotropia, hypertropia, or hypotropia. Really, this means you're looking for uneven gaze in the two eyes. Your two eyes should be able to focus on something relatively similarly. You'll want to hold your pen light about 2 feet away from your patient's eyes and shine it equally into both, so right along the midline. When you shine it, you're looking for the actual reflection, the pinpoint reflection of the light in the patient's pupils. This light, as long as it's held medially and about 2 feet away, should be in the exact same location in the patient's two pupils, meaning that when looking at the patient's pupils, you'll see a little point, just a little pinpoint of light coming from your pen light in relatively the exact same spot. I'll conduct the test now. Here you can see that my pen light is showing up very clearly in the pupils, in both pupils of the patient in relatively the same spot on that medial upper aspect of the pupil. This means that the test is negative for any sort of dissymmetry in the gaze or between the two pupils of the patient.
Hi, my name is Connie Hook-Lamas and you're watching the video Detection of Strabismus Corneal Reflections. In this video, we'll discuss briefly how to utilise the location of the corneal reflection to detect the presence of strabismus, and in particular, the presence of a manifest strabismus. By now, you'll be aware that when you shine a light in the eyes, we will observe a corneal reflection in each eye. Now, normally in a patient who has aligned eyes and there is no manifest strabismus, the corneal reflections will be placed slightly nasally and they will be symmetrically placed in each eye. If we have a look here at the first image, we see that the corneal reflections are symmetrically placed between the two eyes. And in this particular image, or diagram, they've been centred, but like I said, in a real patient, they're slightly nasal. They're not quite in the centre of the pupil. So what happens when a manifest strabismus is present? Well, the corneal reflection will be decentered, and it's always decentered in the opposite direction to that of the deviation. So if we have a look at the second diagram here of a patient with an esotropia, we see that the patient has a corneal reflection that is temporal in the eye that is deviated. So the eye is in and the corneal reflection is out towards the ear. So we have temporal displacement of the corneal reflection in esotropia. So for an exotropia, we have nasal displacement, as we see here. And for vertical deviation will again be the opposite. So here we have a hypertropia. And we can see with this hypertropia that the corneal reflection is lower or inferiorly displaced. If we take a look at the photographs here of patients, we can see the corneal reflection here of the right eye and here of the left eye. And we can see that the corneal reflection of the left eye is decentered temporally, again indicating to us that this patient has an esotropia. So upon observation, we can see that the eye appears to be esotropic, and then corneal reflections give us further confirmation that this eye, this left eye, appears to be esotropic. If we take a look at the second image, here the patient looks to have an exotropia. In clinic, you would then shine the torch on this patient and you have confirmation of what you're seeing because that corneal reflection is nasally displaced, indicating that an exodeviation is present. Okay, so in terms of recording it, we usually will indicate CR for corneal reflections, and then you would just indicate what the coronary reflection is detecting. So in the first image, it's detecting a left esotropia. In the second image, it's detecting a right exotropia. And in the third image, it's detecting a left hypodeviation or hypotropia. Okay, that brings us to the conclusion of this video. Thank you for watching.
بشكركم مرة تانية، وأنا آسف إن الفيديوهات مش متحملة، لكن إحنا هنعمل لكم أبلود للفيديوهات دي عشان you can watch it. شكرا.